to Debbie for letting me speak this morning. And as she says, I'm part of an organisation called Keep Our NHS Public, the Dorset branch, and I'm here with other members this morning. First of all, again, a big thank you to Debbie and to everybody for organising this campaign this morning and for mobilising all of this support. So let's give them all a really big round of applause. And let's acknowledge all the hard work they did through the coronavirus, through the first wave, and indeed every single day, working to support us, to care for us when we're our most vulnerable. So again, a big round of applause and thank you. Keep Our NHS Public fully supports this grassroots campaign, a campaign by people completely at the coalface of what's happening in our NHS. And it's really important that we get behind their demands. They are asking for a 15% pay rise, and nothing short of that is going to be satisfactory. They have seen up to 21% pay cuts in real terms since 2010. So 12% isn't good enough, £2,000 isn't good enough. We want 15% pay rise for our nurses and our NHS workers. And we all need to get behind that figure. And as I said last time that I spoke, I don't actually work for the NHS, but that's not the point, because it's not just people from the NHS that need to support this wonderful organisation. And I think I want you to know, if you do work for the NHS and you're here today, that the public do support you. The public are completely behind this campaign. And it's important that if we don't work for the NHS, that we go out and we speak on your behalf, because of course the NHS is so very important to the lives of everybody. If we don't pay our NHS staff properly, then they're not going to feel valued, they're not going to be appreciated. Our NHS won't have the quality staff that it has now, and that's already happening. We heard from Debbie earlier that there are 100,000 vacancies in the NHS. Just take a moment to think about that number, 100,000 vacancies. How can our NHS survive with that number of people needed to work? And out of that number, 42,000 vacancies in terms of nurses. We as a whole country need to understand that the NHS is not viable with that number of vacancies. So we must campaign for better pay, so that the people who are doing these absolutely vital roles in society are valued, are appreciated, and remain in their jobs to allow us to have an NHS. And we need to be mindful that this is not being done by accident. This current government does not value the NHS. It may well be that the organisation is being run down deliberately. Look at what's just happened to Public Health England. Completely starved of cash, private companies have been brought in to run, or so-called run, our track and trace system. It is in complete chaos. It is a complete disaster, and Public Health England were blamed for that. We need to be careful that in this chaos that's currently going on, and with all those vacancies, that the government doesn't blame the NHS and continue to privatise behind sort of closed doors. They're not saying they're doing it, but this is what is going on. And with more and more private companies being brought in, the NHS is being run down, is being made no more than a logo, and before we know it, it will be gone before our very eyes. So as George said earlier, we must keep going. Talk to your friends, talk to your family, put information out there on social media, and make sure you continue to support these protests on a monthly basis. And Debbie. As I said, I'm part of an organisation called Keep Our NHS Public, and we're very concerned about NHS pay. But we're also concerned about all those wider things that are happening to our NHS. And we have these demands. Well, I'd just like to share with you today. I've jotted them down. What we as an organisation feel should be happening, and what I think everybody who's turned out today will want to campaign for. First of all, we need to rebuild our NHS, and that means proper funding and of course proper pay. We need to stop and halt privatisation, and the way to do that is to repeal the Health and Social Care Act that was passed in 2012. We need to stop outsourcing our NHS contracts, and we need to stop this hostile environment and ensure that there is healthcare for all people. We need to make sure that our NHS, through dodgy trade deals, are not sold off to Americans. And we need to make sure that all NHS staff are supported every single day, not just if we have, and let's hope that's not happening, but a second wave of COVID-19. But we need to value them every single day for the work that they do. Thank you again to Debbie. Thank you for listening, and I look forward to talking to more of you as we continue our protest today. Thank you very much.
Yay! Thank you so much, Katie. That was brilliant. Thank you.